Hello all, this is Dr. Masapu. Many doctors and nurses go to countries like USA and UK. You know why? There are three main reasons. One is the education. The quality of education is excellent there. Number two is the quality of life. The work-life balance is extraordinary there. And number three, and the most important thing, is the financial aspect. The money that you earn is also very good there. This is all true, or are we assuming that this is true? To know the facts, what I am going to do is I am going to interview a person who stayed there for more than 15 years. He is Dr. Ravi. He is anesthesiologist in Dralington University in United Kingdom. So I am going to ask him all these three questions. Also going to ask him about the kids' education, how is it about missing the country and missing your parents in this country, and several questions we'll put him through, and if you want to find the answers, follow the interview till the end. Thank you, Dr. Ravi, for accepting my invitation for coming for an interview in my YouTube channel. So my first question would be, why did you decide, first of all, to go to UK 17 years ago?
Thank you, Dheeraj, for having me here to speak about my experiences in UK. In 2003, when I left for UK, the main reason for me was to have training facilities which was not available in the place where I used to work. The second reason was, at that time the payments were low, mainly because health insurance sector was not so popular and the paying capacity of the patients was low, and our payments were low at that time, and quite a few of my seniors had gone and made a better living there. Then I thought I will also try and move to UK to see what difference it makes to my life.
So, if I can ask some financial aspects of working in UK, since you are a senior anesthesiologist there, so what is the main difference in the financial things?
Yeah, thank you. I mean, to be honest with you, the financial aspect is just an illusion. I mean, there was a difference when 2003. As I said, the payments were really low, and the difference for me, at least in 2003, was at least 8 or 9 times more. Expenses were also there, but since if you go alone and work there is not a lot you spend. Main expenditure is if you have a family, particularly the children and their education, particularly if you put them in the private schools, and that will drain most of your savings in UK. Otherwise, if you are alone and single, yes, you could save. But over years, what happened is, in India, economic growth is so very well happened in last 15 years, and health insurance sector has come in. Most of the corporate hospitals have come up, and government in 2003 comparison wise we had a better payments, but over years with the pay freeze and stagnant payments, increments year on year, finally we are at a stage. The difference is not so much in over 15 years. I mean, here, and the salaries are way better, so the difference is not so much. I mean, here the income may be lesser than UK, but the expenses are also less here, and the increase in the payment, at least from 2003 to now, is at least 6 or 7 times. My colleagues whom I left behind now, they are earning very close, if not equal to me, but their expenses are low. So on balance, not a lot of difference in the financial gain.
Thank you very much. So what I understood is that if it is only the finances that we are seeing, it is both India and UK in terms of for anesthetists, it is almost the same. That is what.
Yes. If you are coming for financial gain, UK is not the place. You want a better system in the for work-life balance and clean roads, clean environment, and children's education, free healthcare. All those aspects, if you look at that, yes, for a better living, you might consider. But having said that, it's the personal choices are there. There are some people who would want with any deficits, whatever. India is better. I used to think that I will come back, earn a little bit more money, and then come back and settle down. But we all have our personal reasons why we stay put. Circumstances are different, and over years, once you get into the comfort zone of staying in a place over 10 or 15 years, you wouldn't want to change what is going on well for you.
Okay, understood. It is not the money. Overall, it is the quality of life which will be better in UK. That is what you are trying to do.
To be honest with you, quality of life for some people it is just a better system. For some people, being close to the family and near and dear ones and enjoying everything Indian. So if you look at the latter aspect of what I described, yes, India is better. If you are looking for something else, clean air, clean roads, free healthcare, free education for the children up to the time they go to the university, all those things, if you consider, yes, probably UK may be the choice. Again, each individual is different in saying what they want in life.
Kids education, your kid is studying in Cambridge University at present, so but that aspect will be good, I think, in UK compared.
We need to understand UK education is really different compared to the Indian education, and the number of children who would attempt competitive exams are proportionately very, very low compared to the Indian kids who are competing in, if not lakhs, probably in millions. Till the high school level, and then even up to the level where they are competing for the university entrance exams and all. The level of competition and the margin of error is also very low, and level of competition is extremely high. You have to be better than the best to get into, say for example, if they are keen on getting the medicine or getting into the IIT. Here they really need to work hard, not knowing that they will still get. You have to be very close to 100%. And the difference between a person who got into the system and who didn't get is probably less than 0.1%, and sometimes probably maybe it is even equal marks, but based on the various categories, caste, religion, all those things play into effect, and they might not even get even. In UK, exam system is fair, I must say.
If you are reservation system there?
No, there is no reservation system. There is no reservation system. If you are good, yes, you will get, and the competition is less. And for most of the Indian children who are academically orientated, mainly because the way they are brought up, and particularly if they belong to the professional families, we all give so much importance from the beginning. So they will have that culture of yes, come back, play some time, and then get to their homework and complete it. There will be some differences in some families, but generally overall what I see, Indian children do better.
Many anesthesiologists and other professions, the moment they finish the post-graduation, they are planning to go to UK. So what is one suggestion that you would give them, or which with 17 or 18 years of experience, some with wisdom, what suggestion would you give them? That is one thing I would like to.
A lot of doctors whom I have interacted and who expressed their wish, I want to come to the UK. I must say they didn't have a clear vision why they want to come to the UK. A lot of people thought that there is better payment there, and a lot of people thought that they will settle down no matter what their nature of the job is going to be. You really need to invest some time in yourself to see are there any other better opportunities than UK. If you do not know why you want to come to UK, are you coming for a better training facility than what you have already acquired? In India, a lot of corporate hospitals are there, better educational facilities are there, and they usually either you get a diploma in anesthesia or MD anesthesia, or even diploma in national board exam. If you pass this, you are still a specialist, or depending on the experience, you can become a consultant here in India. But whether it is considered abroad, that's another thing. And generally, with the way things are going, competition, and with the view to earn more money than here, people think about going abroad. And the opportunities are either you think about your UAE, UK, Australia, New Zealand, or Canada, or US. I mean, there are regulations there. Not everybody can get into that. Yes, in UK, different schemes are there for the professionals. And if they have vacancies, yes, they will advertise. But most of the training schemes are like 2 years medical training initiative, MTI they call, and after 2 years they will have to come back. And the other vacancies which are normally available are for non-training posts, like specialty doctor's post. They are permanent, but they have a ceiling. There is no growth. So people who come there, whether they want to use that as a springboard and then try and keep on attempting to get into the training, so that they will complete the training and try and become a consultant. But there are a lot of visa regulations will be there. They have to get through a lot of hurdles to go through that. And if they are coming for the money's sake, I must say UK is not the place for a better payment. I mean, in India, as I see, the difference has narrowed down so much in the last 15 years between people who have gone to UK and people who have stayed back and been practicing anesthesia here.
Got it. So, last few questions left, and so what do you miss in India? Because you are like almost like a citizen there. Almost 17-18 years is like you are away from the India. So what do you miss here, and what is that? If I give you a time machine, would you still go back to UK, or what is the thing actually?
To be honest with you, you asked a very difficult question which straight penetrates into my heart. This is $1 million question. But the straight answer for any Indian who is living abroad is whether would you want to turn back the clock and stay put in India? The answer is 99% yes. It may not be so for the second generation Indians who are living in UK because they have not got the flavor of India. I lived in India for first 33 years of my life. I missed everything about India when I went to UK. Whether it is food, culture, people, interactions, laughter, all the emotions, everything I missed. So till 2015 I didn't even buy the house, thinking that yes, I will go back. But things keep happening differently at various phases. Your personal circumstances change and you slowly get sucked in the system. You get into the comfort zone and you do not want to change anything what is going on very well. So, yeah, if you ask me, do you miss India? Yes, always. India is always in my heart. Any moment. My mind is always thinking about my near and dear ones. What I can do. So now these couple of months I have stayed here and worked in the hospitals in India. These memories are refreshing, how I was in India up until then. So thank you for having me here, and you have rekindled all my emotions dated back to my first 33 years of life.
Almost since 1 month you've been working with us, and so I don't tell that every setup is like our hospital, but now more and more advanced setups are coming up even in India. So even for education purpose also you feel that so we can actually stay in India and continue. That is some kind of a conclusion you are telling.
Initially in 2003 not many super specialties setups were there at that time. So whether it is the advancement in the anesthesia or equipments on the surgical sides, there are a lot of things which were we have read in the books but not practiced or not seen because of the financial restraints at that time. But now, looking at the hospitals, even including the government hospital, the equipments and the anesthetic techniques, everything is far advanced. Yes, there is a scope to improvement as always. Each day or each month it will bring in a new things in the healthcare for the betterment of the patient safety, but for giving the best care to the patients. I mean, that attitude is there with everyone, but here, yeah, some hospital you all work with the restrictions you have, mainly being not able to use the advanced equipments or suture materials or even the anesthetic drugs, but you always have found an alternative way to overcome that, and finally you are given the same outcome as outside India. So now in this particular hospital, I have seen it is no less than any UK hospital in comparison. What I would like to say, the skill set of the surgical colleagues or anesthetic colleagues, because you handle so many patients, like the skill set is amazing. I wouldn't want to compare with the UK contemporaries. What I see here is everyone is trying for updating their knowledge, which was not there in 2003, I must say. Our life was go to your work, do some private practice, try and make the ends meet in a better and better way, because there was no system, and I didn't even have a health insurance at that time. There was no fallback system at that time, and your earning was meager. Expenses were meager, I agree, but there was no gearing up for any kind of emergency, which may be like, it may not be just yours, your family members or extended family members. What if something goes wrong? During that time, there is no contingency plan, because you don't have a financial savings to accommodate those kind of emergencies. So the only way you think is, yes, I need to save. In UK, I mean, very few people think about saving, because system takes care about the healthcare and education. These two are the main things.
Question. So coming to the social service activities, I know you're involved in some of the service activities. Even from UK, you'll be conducting some kind of charity work in India as well. So what kind of service activities you are conducting there? The last I would.
Charity is given utmost importance in UK. We do have our social gatherings, and there is always a charity box, and our meets in UK, say for example it is a Kannada Balaga or Northeast England Kannadiga Koota, NEEK we say, or Veerashaiva UK. There's so many organizations. I mean, when we meet, whatever the leftover saving is all given out for the charity, and they are registered as charity organizations, and usually the general trend is to send the charity money. You identify a charity institution or an organization which needs a fund, you identify it before and then announce it when you are actually conducting these events, and whatever the money which is generated will be given to them normally. I can't remember on top of my head, because during the COVID time last couple of years our social meetings have come down significantly. Now online meets are there, but the fund generated is not so much.
So thank you very much, Dr. Ravi, for the interview. So I'll just try to summarize the three main aspects. Number one is the quality of education. So if you really think the quality of education is very good in developed countries, it is not totally right. It might be slightly better than here, but if you target good institutes like AIIMS and NIMHANS and Sri Chitra and other good hospitals like Manipal and etc., the quality of education is on par with the developed countries. And also I could say it also depends on the person, and if you are very enthusiastic and if you have a learning mindset, any place is same for you. You will be learning. And second thing is the quality of life. So if you really want clean roads and clean houses and everything, surely I think going to the other countries might help you, but at the cost of what? At the cost of missing your parents and at the cost of missing the country. So that is a personal choice. You need to take a call. So coming to work-life balance is surely good in UK according to Ravi, but even in India, if you choose to stay in institutes and bigger teams, work-life balance is very good. Third, and the most important thing, coming to the financial aspect, according to Dr. Ravi, if you think that you can make more money in UK and other countries, it's a myth, because there you will be spending a lot of money in the form of taxes, and also the expenses are pretty high and the rents and everything will be in the next level. So the amount of money that you save will be almost similar according to him. I think that you're going to become very super rich by going to other countries, it's a myth, but by the knowledge that you get there, if you come back to India, then you'll be placed in a better position than people who are trained in other places. So in that way you can become rich. I hope you learned a lot of things from this interview, and I will do more interviews like this in future. And thanks for watching the video till the end, and if you are coming till here and not subscribing to the channel, then